In America, the ideology is the rich receive better treatment. This expands across many categories: better clothes, better houses, better hired help, and better health care. The privatized healthcare system in the United States allows for better and possibly more advanced treatment. Health insurance is designed to help cover some of the excessive costs of medical care, but policies are often very confusing and come with many restrictions and loopholes. There are also positives to the system, however. There is flexibility in being able to choose a physician, and the time it takes to receive healthcare is fairly prompt.
There are a large number of people in the U.S. who are uninsured, which creates problems. These people are usually unemployed or underemployed to the point that they just cannot afford the added expense. Someone in this position may postpone seeking help, and when help can no longer be delayed, they may run into serious financial and worsening medical problems. Someone wealthy who has suffered from a medical emergency has a better prospect for recovery, given that they would seek help sooner than someone who lives in poverty and suffers the same fate. Other countries have adopted a variety of different healthcare systems. One that the privatized U.S. healthcare system is often compared to is the National Health Service that was instituted by the United Kingdom. The National Health Service was adopted in 1948. The idea was to provide free healthcare to those in need, regardless of income. While the system is still essentially free for everyone, there are some prescriptions that cost money, but it is mainly funded by taxes. Who makes up the National Health Service? The system employs more than 1.7 million people. The Chinese People's Liberation Army, Walmart, and the Indian Railways are the only businesses that employ more people. While the national health system is comprised of the multiple countries that make up the United Kingdom, England is by far the largest part of the system. It employs 1.3 million people that serve a population of 51 million. Where does the money come from? The English system is funded directly from taxation. The government feels this is the fairest way to fund the system. It costs the average British citizen £1,980, or $2,979.24 annually. Where does the money go? In England, 60% of the NHS budget goes to employees' salaries. Another 20% helps to cover the costs of buildings, equipment, and training, while the last 20% is used to pay for drugs and other supplies. How effective is the National Health Service? Since the NHS has been instituted, the life expectancy in the entire UK has been rising, and the infant mortality rate has been falling. Based on surveys, patients seem very content with the care they receive from the NHS. Even though the system is very different from the one in the US, there are similarities between the two. The main cause of death in both is heart disease, and the life expectancy is comparable. However, neither organization compare favorably to the high-achieving systems in Japan and Sweden. Regardless of the pros and cons, similarities and differences, there will always be people for or against the structure of the systems. It is obvious that the healthcare system has shown vast improvements in the overall well-being of the citizens in the UK.